Good afternoon and welcome. My name is Richard Sachs. I'm Provost and VPAA here at University of Rio Grande and Rio Grande Community College in Rio Grande, Ohio. And I'm delighted today to have as my guest Robyn Blache, who is the director of our new Jackson Center. Rio Grande, our service area is 4 counties, Gallia, Meigs, Jackson, and Vinton. As most of you may know, we have a full campus, a 180-acre campus here in Rio Grande. We have a center in MacArthur at the old Vinton High School, and we also have a center in Pomeroy just off Route 7, and that's our Meigs Center. One thing I've heard about from people in both the city and county of Jackson is that Jackson is the largest demographic county in our 4-county region and the only place where we do not offer classes. Well, that has changed thanks to the guests that I have here today. Robyn has only been, I guess you've been here about 3 or 4 months, is that
just
about right?
Just over 3 months.
Yeah, just over 3 months. But she's been in the region for a long time, much of her life. Can you tell us a little bit about your background before we start talking about the Jackson Center?
Sure. I moved to Ohio when I was 1, to Rio Grande. So I've been here pretty much my whole life. I attended Ohio State and moved back to the region, actually, and attended a semester here at the university in the nursing program.
Did not know that.
Yes,
okay.
I was here for a semester and then actually went abroad to Australia, so moved away for a little while for school and then came back. I've actually co-opened a small business here in Rio Grande called a Robyn's Nest.
So tell me about Robyn's Nest, and that is Robyn with a Y.
Yes.
I'm married to a Linda with a Y, so those of you who think I is the go-to vowel, I have a guest here who would say otherwise. But tell us about Robyn's Nest. It sounded charming.
Well, actually, it was just a little pet project that I've had with my mom for years, and we decided to just make it official one day and open up a business. It was a craft shop primarily, but home decor, quilting. I'm a quilter from way back, so it was a good opportunity just to do what we love.
Okay.
And it's so funny, I always said that my mom was almost like served the same role as a bartender, but to a different demographic set, because all the different ladies would come in and we just knew all the community.
And as somebody who's taught American Studies for 3 decades, I love the quilting patterns. And some of them, I know years ago I read a paper on one like flying geese and all the triangles, the various shapes and things like that. It's really fascinating. It's true Americana too.
It is, especially you know, we're celebrating the history of, the anniversary of the Civil War.
Sure.
And you can get into a lot of fascinating history with the various quilt patterns and their role in that.
Sure. Yeah, well, that's great. Well, tell us a little bit about your educational background and especially your expertise in medicine and health allied professions and what brought you, why you were such a good choice for us to direct the center. Okay.
Well, actually, when I started school at Ohio State, I was in design, the marketing and design for like fabric and textiles. Sure. But my work study job at Ohio State was actually for the James and doing medical billing and coding. And very quickly the director there said, okay, one of us has to know what we're doing with this coding thing, so go become certified. And at that time I actually switched my major and was in nursing. And that's where I came to Rio too. I was in Rio's nursing program for a while. But just really found my niche with medical coding and compliance.
Okay.
And I have done that pretty much my entire career. My degree actually ended up being in English. And then I just recently finished up my master's in health law from Loyola in health law.
Oh, great. Okay. Now, tell us about the coding languages, because those of us who just access the medical system, I know, as I've had various knee surgeries and back problems and things like that, I'll actually have doctors say, I'm going to code this way so your insurance pays for it, or you know, they'll put something through and then I'll have a huge bill and I'll call the doctor's office and they'll say, oh, we should have coded it like this. So can you explain the coding languages, and you have informed me about the shift from 9 to 10 in the coding languages, and
sure.
I'm sure this would be interesting to our guests.
Okay, well basically medical coding serves two purposes. The entire world uses ICD-9, and then there's also CPT coding. ICD-9, which has now switched to 10, as you're referring to, and it's happening here in America. The rest of the world has already done it. That is basically the language you report your diagnostic information with. So, the reason for the visit. And the rest of the world uses it through the World Health Organization for statistical purposes. So that is one half of the language. The other half of the language is the CPT, which is procedural type, or what happened, what was done. And that is created and owned by the American Medical Association. And interestingly enough, America is really the only nation that uses this language for payment purposes. So in America, we do use the clinical modification version, and we submit and communicate with various payers about what's going on with this language. And it is an alphanumeric language that basically you turn an entire visit into a series of numbers so they can then value and establish the medical necessity for that visit.
Okay. And my understanding too is that 9 had like a couple hundred codes and 10 has like thousands of codes?
It is expanded dramatically. Basically, with ICD-9, it was a 3 to 5 digit, and it was only digits, so a 3 to 5 digit code. And there was approximately about, say, 17,000 codes. And that is a loose number because there are a few others that other people use that we don't. But then also, now with an ICD-10, it's expanded to well over 140,000.
Oh my word.
And it's now 7 digits, and it's alphanumeric. So it expands the role that it can play
Right.
largely.
So ideally, doctors and healthcare professionals will be able to have more exact coding, and then in terms of what that does for the job market for medical coders, I know people at Holzer Hospital, people at Adena have said we need as many coders as we can find, and so there's not only a demand as is, but as we go to the new coding system that is used internationally, the knowledge base will have to improve, and the demand will just go up astronomically.
Exactly. There's kind of a two-part, I guess, answer to that. Obviously, if you can't speak the language, you can't submit a claim and get paid. So you need to have at least a basic knowledge in order to even receive payment for the services that are being performed. But there's a second layer to that, and then the reason for a good, solid, knowledgeable, certified coder, because a coder who knows what they're doing truly helps a physician or a hospital facility recoup all the money that they're due. A good example, a lot of codes are based on size or complexity, and it can easily be undercoded, and the doctor doesn't get the reimbursement that they've earned.
Sure.
So the value of a good, knowledgeable coder is just hard to put a dollar sign on.
So if there's someone in the listening audience who's interested in the kind of certification that we're providing now at the Jackson Center, what would be a reasonable time frame for them to go through it? And again, our fall term starts Monday, August 24th. And I know from checking enrollments, our enrollment seems strong, but there's still some room in some of those classes. So if somebody came to you or to me, is the answer 2 years, 1 year?
Well, it varies.
Yeah.
There's a couple tracks. We've worked hard with the grant that we've partnered with to accomplish a couple of things. As students who are interested, they can basically take a traditional college course or path that would take about 2 semesters to complete, and we're working on getting a certificate program, but also networking and getting to where that student's qualified to take a national certification, which would be a certified professional coder through the AAPC, or the American Academy of Professional Coders. And that certification basically gives them the endorsement that they need to say, yes, this person knows what they're doing. Because there are a lot of fly-by-night, I hate to say it, but coding educators that aren't quite as qualified, so the product you get is not as qualified. We also have a non-traditional route, which is a boot camp that students can enroll in, and it takes away some of the general education courses that you would obtain with a college degree, but it allows a person to start working immediately. We've worked hard to make sure that those that go that route can still eventually go the college coursework route and finish up and round out and get their certificate or an associate's degree.
Okay. And obviously, I know you have courses on ICD coding, you have courses on medical insurance reimbursement, medical terminology.
Yes.
What are some of the other courses that students would take to fulfill the certificate?
Well, either route, they're going to need basically a couple of fundamental things. They need to know anatomy and physiology. So that's usually a two-part class here over 2 semesters, or the boot camp combines it into one.
And that's what we call A&P 1
yes.
and A&P 2
exactly.
in academic parlance. Yeah.
Exactly. Yeah. And basically, and medical terminology is a big thing, because a coder, I love coding because you kind of are in the center of the medical process, but you also cross over into legal and billing and business, so you get to wear many hats.
Sure.
But someone who's working in medical coding needs to be able to take the doctor's notes, read what happened, and turn that into numbers, so they have to have a solid background in medicine themselves. One thing that it's really been enjoyable is you get to learn a wide variety of skill sets and insight into various medical specialties.
Sure. It's interesting, nomenclature is so important in all areas, and as somebody who's taught English for 30 years and never took an A&P course, although I've overseen departments that do, I've always told my students as I teach them terms of literary analysis, not just metaphors and similes, but things like synecdoche and personification and things that are not common, of common parlance, I reference the shin. And I say, if you're a doctor, you don't say he broke his shin bone. I say, you say it's the tibia or the fibula. And so I always had enough language there to say, now it's the same thing. We read a poem, we can't say, oh, that's beautiful. Oh, yeah, that's beautiful. Yeah, that's beautiful. No, we have to start talking. What kind of metaphor was that? What kind of syntax was used? What kind of diction was used? So it's funny, I've always used medical terminology as a metaphor to teach English. And students understand that no doctor would say he broke his shin bone. They'd say it's the tibia or fibula, and whether it's a green stick fracture, the various different levels of that. So yeah, that's fascinating to me. Now, this is an area of the country and an area of Ohio that does not have some of the huge medical centers you might see, say, in Pittsburgh or in Cleveland. But we do have 2 very large medical groups. We have Holzer Hospital in multiple locations, and as you go further west, we have Adena Hospital in multiple locations. And what kinds of connections are we having with them? Were they part of getting this grant, the Southeast Region Industry Workforce Alliance Partnership Grant, or are they considered partners in the project?
They are considered partners. Basically, when we got ready to apply for and go after this grant, we met with various industry leaders in healthcare to say, hey, what are some of the needs that you anticipate? What are you looking for to, who do you need to employ? Or who are you having a hard time finding? And every time we got back, we need coders. We need good quality coders, because again, when you work in that industry, I think you quickly realize the value of a quality coder. So that was consistent feedback that we've gotten. We have worked to form an advisory board that we have representatives from the various counties and various, I guess, size of practices, whether it may be a 1 or 2 doc office or an extended care facility, because that's the other thing. All areas of healthcare rely on this. They speak this language for billing purposes. So whether it's let's say a pharmacy or a durable medical equipment distributor, supplier, home oxygen, any of that, home health care, nursing homes, they all need this. So it's a very versatile skill to master.
Yeah.
And so we've tried to tap into all those various representatives and get an advisory board put together where they can tell us what they're looking for, what their needs are. And we have other programs that we offer at the Jackson Center. Obviously, there's a lot of allied health programs we're going to try to make available to the community, but we're starting with coding because that was the #1, especially in light for the transition.
Yeah. Well, and your answer kind of looked toward my next question, and that is, what kinds of job possibilities are there for graduates? Obviously, the big hospitals need coders.
Yes.
can a small doctor's office afford a coder?
Absolutely.
Or do they have to find, do they have to have a coder? Or do some of the nurses do the coding in a smaller office, or not?
It really varies how it's set up. They depends on how the business office is arranged. But, you know, we're quickly approaching October 1st of this year, which is when the mandatory transition takes place to I-10.
Really? Okay.
So this is a federal law that requires this to happen. There's some potential wiggle room introduced into Congress. I don't know that it will pass because the American Medical Association has gotten on board with this transition now. So I think everybody has agreed we need to make the transition. We're the last industrialized nation to do so. But basically, depending on how they're structured, and this answers two-part again, prior to October 1st, yes, there's a lot of different people doing coding, but again, more and more people are realizing the value in knowing what you're doing, because you can leave a lot of money on the table if you just have, well, we'll have the receptionist do it. You know what I mean? Or we'll just, and you know, it's a training that you need. A lot of offices see the value and they'll dual train someone. So they'll want them to operate as a receptionist or a front desk person, but also, you know, you're going to do our billing, so we need to train you in this field too.
Okay.
Now, having said that, as we make the transition for ICD-10, just because of the great expanse of available codes, it goes actually back to your metaphor that you use in English. You know, the language has to be so much more descriptive and complete now.
Exact, yeah.
Exactly.
Yeah.
So you really need someone who knows how to, if they don't have that level of specificity in the documentation, they need to be able to take it back to the physician and say, okay, doctor, I need to know X, Y, and Z additional information in order to code this for you.
Yeah.
So we really need a knowledgeable person to get the claim out the door in the first place.
Yeah.
So I think as we make this transition in October, just having anyone do it is no longer going to be an option,
right,
just because of the skill set required.
Yeah, and I know a lot of Americans often complain we have too many rules, we have too many guidelines, but one thing I love about America is I can go anywhere in the country, and if there's a public water fountain, I can drink from it, and I know it's going to be decent water. Mm-hmm. And that's simply not the case in other parts of the world. And so I think it's kind of the same thing. When I was in high school in the early 70s, my brother, who was a very good swimmer, got a job as a lifeguard, and he did not have senior life saving. He didn't have WSI. Mm-hmm. He was fine as a lifeguard. My second oldest son, when he became a lifeguard several years ago, he had to go through all this training and documentation, or no city pool would hire him. So I think in medical care, we're usually okay with increasing levels of documentation to make certain that people, the appropriate people, are doing those things. Tell us a little bit about the Jackson Center. I know it's right on Route 93. I've been out there a few times. It's currently leased space, but you have done some extraordinary work with that. So
we've done a lot of renovation.
I know it's like 14693 or something.
I think so. Suite 1. Yes.
Did I get that right?
You did, I
14693?
I think so.
I thought that was an old girlfriend's phone number.
Well, let me say that it's just down the street from Walmart. We're on in the little strip mall beyond Walmart on 93 heading towards Oak Hill. And we're in Suite 1, and we have our new signage up, so you can see you know, that it's a campus or a center for the University of Rio Grande, as well as we have our partners listed with the grant. It is funded originally by the grant, so we have other representation there as well. But basically, we're super excited. I think we've got a lot of exciting things going on. Obviously, we've just started. We had summer classes this summer for a few students, but we are excited about our fall offerings. We will have the 2 various coding routes that you can take. So there'll be the traditional college coursework for coding. There's also the boot camp option. We're working with getting some other curriculum offered, programs offered for actual certification and job placement. It will be a hybrid right now between offerings there and then some that you will come back to either online or to the university, the main campus here in Rio.
Right. Right. Well, that's very exciting. That sounds good. And I don't want to embarrass you, but you and your husband Ian did some wonderful things inside, including the tile,
Yes.
which I was amazed at. As you come in, it's beautiful. There's some inlaid tile in the wall. The whole place is clean. There's multiple classrooms. There's computer access. So even though it's just a center, and thus far the space is leased, we really hope that people from Jackson City, Jackson County, and elsewhere come to that place. And as Provost, I certainly hope that we move well beyond the next year into the future, either in that site or a different site in Jackson. Now, it's like an L-shaped office building, and we have the curvature of the L.
Yes.
That's our spot. Then there's some empty places. And then is it called the party spot?
The party barn.
The party barn, because the first time when I texted it into my phone, what came up was the party barn. And I've never had an academic place called a party barn. But I thought that can only help, probably. You know, we could possibly get some more students that way if they're headed in that direction. But I guess the point I would make is there's a lot of retail along there.
There is.
And so that should be accessible to people, and also being right where, I'm going to get this wrong, but essentially 35 and 32 come together,
Yes.
right?
Yep.
So 32 to Cincinnati, 35 to Gallipolis, and into West Virginia. So you could literally be 10, 20, 30 miles away and be only 10, 20, 30 minutes away
Exactly.
from that center. And
As we're enrolling students, actually, for the coding programs, we've gotten students from 4 counties now, actually, for the
really?
coding program. And that illustrates 2 things to me. One, the need for quality coding programs in the region, but also that it is easily available. It's centrally located, so we're really excited about the potential at that specific location. And getting back to the layout or the decor, we worked hard to try to make it an atmosphere where, you know, if a student was in a program that they had to spend the day, it's a nice environment. It's clean. There's computer labs available, so you can do additional work while you're there. So I think it's a good spot. You can run out and get some lunch, come back and spend the day without really having to run all over an
Right.
area.
Yeah. Now, one of the challenges in offering coursework that has enough students for it to be sustainable is to make certain you're offering the appropriate curriculum and at the appropriate time. You've made a compelling argument today and over the last few months that this is a program that we need and that the area needs and that the country needs. A bigger question is, because I know we're offering some classes in the evening. I know we've looked at Tuesday, Thursday, and Monday, Wednesday schedules. Do you have a sense of the population for this? Are these people who are working full-time who need evening and weekend classes? Or are they people, I know that Job and Family Services, Jackson County Job and Family Services is one of the partners, and is Vinton and Galley and Meg's JFS partners as well?
They're not official partners, but we've
Okay.
been working with them fairly.
So, and those are mostly people who are trying to look for a new profession, trying
Exactly.
to re-enter the job market. Now, I would presume those people may be more flexible and take classes during the day, but do you have a good handle on that yet? Or maybe we could ask people in the audience even to feed back to Robyn or me about ideas on that. But
Certainly.
what do you see so far in terms of your needs assessment?
Well, actually, we see a pretty strong mix. It seems to be split between individuals who have worked in coding and want to get that next level and become certified as a medical coder. So we've got a lot of people who actually are working full-time already who require evening classes. And then we also have individuals who are just looking to change a career. They're a displaced worker who are starting over after losing a job, and this has proven to be a very good and lucrative field to go into. So those people that go that route typically go the Tuesday, Thursday college coursework path. The good thing is, since this is grant sponsored and funded, there's lots of additional funding opportunities for someone who isn't interested in taking this program. We can help obtain funding and kind of start you on your path, if that makes sense. We do have day and evening options available. We have hybrid where you're 100% in the classroom, or then there's hybrid where you're doing most of your work online and then 1 day a week in the classroom too, as well.
Okay. Now, I know that there's always some concerns about how much people in medical professions get paid. Everybody knows about the wealthy doctors driving their Porsches. And I've seen now nurse practitioners on average, which is a nurse on steroids. I should not use that metaphor. Those are nurses with additional certification or whatever. Some of them are making six-figure incomes. And I know as I've had to try to hire nurses both here and previously when I was a dean in New Mexico, it's so hard to hire nursing professors because they can make more in the private sector than in academe. If somebody goes through a coding program, I assume the entry-level pay is not great, but that there's room for advancement.
Well, actually, if you're a certified coder, the entry level, especially for this particular area, is great for a couple of reasons. It's easy to start in the mid-teens to upper teens if you're certified for your pay, and then obviously as your experience, it goes up with that. Also, various specialties in medicine, it's harder to code. So to get someone with that certification in that area, you're going to make more money. One benefit about coding is you can do it from home now. So you work from home and you can go outside the region. Like I have several friends who work for companies either in Texas, California, or North Carolina, and they're able to get paid at that economic rate because they're working out of there. So there's a lot of options.
Okay. This has been a fascinating discussion. I wish it could go further, but we're in our last minute. Do you want to mention the address and phone number? I don't think we've mentioned the phone number yet.
Sure. Anyone interested, and I apologize, I have to read the phone number. We are brand new, so bear with me. But anyone interested in the program can call us at 740-577-3555, and that is the phone number to the Jackson Center. You can find out more about our medical coding program or any of the other classes offered through the university there.
And we had a cohort group that started this summer. We'll have another one starting the fall and at periodic intervals.
We're enrolling now for fall classes of August 24th.
Okay. Thank you, Robyn Blache.
You.
It's been delightful. And thanks to all of you for listening. I hope you've enjoyed the conversation.